In the last video, we discussed about the global travelers' preferences and people who are coming for treatment. What are their best choices and what are the treatments available with us? We'll continue that discussion. Just give us a few examples where how this wellness treatments works here. For example, what is wellness and how do people approach wellness treatment?
So Ayurveda gives prime importance to preventive aspect. That means we have all heard the proverb, prevention is better than cure. So in Ayurveda also there is a different speciality, that is preventive medicine. We call it as Swastha Vritta. So before any disease coming itself, prevention is very much important. By prevention, we are meaning that we are optimizing the body, detoxifying the body, reducing the toxin level and bringing it to optimum function. So this aspect is covered under preventive medicine. So in wellness also, prevention is the most important part of wellness. So different therapies are being done in Ayurveda in the wellness aspect. It is also rejuvenation. That means optimum relaxation and rejuvenation is provided to the patient through different therapies like Shirodhara, Abhyangam. All this is prescribed by the doctor based on the condition of the body. And so it is personalized medicine. That means no two patients will be having the same treatment. That is not the right method of Ayurveda treatment. It should be unique to each person and that is completely based on that patient's basic body constitution, the condition of the body at that time, the seasonal changes, the lifestyle patient is living. All these factors should be considered before doing Ayurveda treatment. So, what makes Ayurveda different from the normal conventional type of wellness is wellness in Ayurveda is very much personalized. As I explained, it is based on the patient's body condition, and we do consider the status of the mind also. So, based on that, different therapies are being curated by the doctor, is prescribed by the doctor rather. So that prescription by the doctor is very much important.
So in this Karkidaka Chikithsa, what are the treatment what a patient experience or what kind of precautions they have to make or how long is going to be the treatment? Can you just throw us some information on that?
A Karkidaka Chikithsa or monsoon treatment, that is according to the patient. You cannot be telling like 7-day package, 14-day package, 21. It is being done in some parts, but it is not authentic Ayurveda. So Ayurveda is according to the patient's body type. So first the doctor has to do the assessment of the body and understand what exactly the status of the body is, how is the digestive fire, how is the digestion, how is the bowel movement. Different parameters are being assessed. After all these assessments only, we come to a conclusion how to go on with the treatment, and that varies from person to person, as I told earlier. So based on if the patient is very stressed, for example, then we give importance to the mind therapies, or else if the patient is suffering from back pain or any other problems, then that problems is being taken into consideration and specific personalized treatment is being curated for that patient. So a specific time is not being prescribed as a benchmark, but then it varies from person to person. But generally, in and around 2 weeks is what usually patients come for, and 2 weeks of rejuvenation is really good for the body and mind. Just to be free from the tensions and hard work of day-to-day life, getting back to relaxation, getting back to nature, getting back to our roots and feeling like ourselves once again. All these brings tremendous amount of positivity to one's life.
So in Karkidaka Chikithsa, what are the treatment we undergo?
Okay, usually in Karkidaka Chikithsa, we do have internal medicines. That means medicines which are taken internally as well as the external treatments. Again, internal medicine is based on the patient's condition, and externally we undergo different types of treatment like Abhyanga, Shirodhara, then Vamana, Virechana, Vasti. I will explain which is each one. Vamana is the therapeutic emesis, in which it is like therapeutic vomiting. So the toxins are being taken out from the body, and Virechana is the therapeutic purgation, and we do have different types of enema, And in Kerala Panchakarma is something a different speciality in Ayurveda. So we do have pottery. Pottery means like the kiri, the so-called kiri, is being used, adding different types of herbs into it. Yeah, so again, the choice of herbs is dependent on the availability as well as the condition of the patient, and so different types of pottery is being used. So it is a wide spectrum of treatments that is being included into Panchakarma or Karkidaka Chikithsa. And we cannot make any pattern or any packaged based treatment that is not authentic Ayurveda. So if anybody who is dreaming or who is planning to take Ayurveda treatment, it is very mandatory that you have to take authentic Ayurveda treatment so as to understand the depth and the root cause of the problem you are suffering, and removal of that is only possible to the so-called assessment and treating according to the condition.
So that's a very informative discussion, and we'll be having some more discussion on this Ayurveda topics. So I think this is the right time to discuss about Karkidaka Chikithsa, because a lot of people are undergoing Karkidaka Chikithsa during this season. So it's very informative. Thank you so much.
Thank you very much.